From the Center for the Study and Teaching of Writing at The Ohio State University, this is Writers Talk. I'm Doug Dangler. Dr. Stephen Gabbe is the CEO of The Ohio State University's Wexner Medical Center. He has authored numerous medical articles proving, among other things, that diabetes could alter the ability of a placenta to provide energy for a fetus, a finding that had a marked impact on 1970s prenatal care. He wrote the clinical guidelines for managing diabetes for the American Congress of Obstetricians and Gynecologists, and he acts as the senior editor for Obstetrics, Normal, and Problem Pregnancies, a medical text which the current edition weighs in at 1,312 pages. So welcome to Writers Talk, Dr. Gabbe.
Thank you. Glad to be here.
Thanks. Now, right from the beginning, you, when you were a medical student, were very involved, as one might expect, in medicine because you diagnosed yourself with type 1 diabetes as a third-year medical student. Is that accurate? Okay.
Yes. So I was doing a rotation and developed acute symptoms and suspected what was happening and did some tests and then went to student health and they confirmed my diagnosis.
Okay. You said in a recent interview, I realized the more I learned about caring for pregnant women with diabetes, the more I'd learned about my own diabetes, and then I could share that with my patients. So it seems fair to say that your medical history has influenced some of your career. Tell me about the development of this textbook, then, which has a lot about obstetrics and some about diabetes, not as much as the next. But how did you get started on that? What led you down that way?
Sure. Well, I had started off in high school and college as a newspaper reporter, so I enjoyed writing. Okay. And I had some great mentors who helped me and taught me how to write in a very direct, fact-based manner. And that really helped as I got into medical writing, writing research papers, writing chapters for books. And I was about, a dozen years into my career after training when a friend of mine, someone I'd met during my training, said he'd been approached by a medical publisher to do a book on obstetrics. His area of the specialty was pretty narrow. He was focused on genetics and prenatal diagnosis. So he told the publisher that he had two friends who were more involved broadly in the specialty, and he wanted to talk to them. At that time, there was really one textbook in obstetrics, Williams Obstetrics. It was written by the folks at UT Southwestern in Dallas. And it was how they cared for pregnancy. Didn't have contributors from around the country, was relatively narrow in its focus. So the three of us met, talked about the opportunity, and then we did some fact-finding, and we talked to folks we knew around the country and asked them if there was a place for another obstetrics textbook. And the word we got was yes. We need something that's more balanced, that has more opinions about how to manage patients beyond just one institution, as good as it was. So we decided that we would work with then Churchill Livingstone and prepare the first edition of the book. I remember hearing from the publisher some words of caution. They said, only a third of the books that people sign a contract to write ever get finished. Either because people just give up or just find they can't do it. And next they said, and of all the books that do get published, only 10 or 15% make it to a second edition. So those were some challenges.
What's the percentage that make it to the sixth edition? Do you know?
I don't know, but I can tell you that the books on my bookshelves, there aren't any that are in the sixth edition.
Okay. Well, tell me about the editorial process that you go through for this. How do you choose collaborators? You mentioned that they're spread out across many different fields, many different areas geographically.
Well, we've been doing this now for about 30 years, so the process has really changed. When we began, we decided we wanted to write a book that would appeal to medical students and residents and fellows. That it would be a book that you could read a chapter in a single evening. So if you had to prepare for a presentation the next day or learn more about a difficult patient, that we wanted to have both normal and complicated or high-risk obstetrics in a single volume. We wanted to have a book that had, as I said earlier, contributors from throughout the country, so we could get as many opinions, as many people's experiences as possible. So we looked at the people who were the leading leaders in the field in each of the important topics in the specialty, and we invited them to prepare chapters. Virtually no one turned us down. They all agreed to write their chapters. At that time, we didn't have word processors. We didn't have the web. We didn't even have fax machines. So the chapters all came into us typed, and we went from there. Now, one of the things we really wanted to do was be sure that the style of the book was consistent, and that while people might write about it, the same topics in different chapters, we didn't have dramatic conflicting opinions, where in one chapter the author said, I do it this way, and in another chapter someone said, well, that way is absolutely crazy. So I decided, and it's been true through all the editions to this day, that I edit every chapter for the final editing. I go through every chapter, I edit it in style, and I make sure that the facts agree, or if they disagree, that there's an explanation why they disagree. And I think that's given the book a consistency that people have appreciated. It's been a lot of work, but I think it's been well worth it.
How much time would you say it takes to produce a new edition? How long is that whole process?
Right. So we generally will start about 2 to 2.5 years before the book is going to be published, with the target of having the book to the publisher for printing. Well, originally it was with about a year, but now, because technology has improved, we can get the chapters in closer to 8 months before the book will be printed. We look for people, as I said, who are leaders in the field, but also very important, we look for people who will get the work done. In every edition, except this one, the 6th, we've had people who just didn't keep their word. And we found ourselves having to take on those chapters as editors ourselves. The first few editions were just 3 editors, myself, Jolie Simpson, and Jennifer Nebel. And we've known each other since the late 60s. And then, because we were getting older and we were doing more and more administrative and leadership positions, we added editors who were more like we were when we first started the book, people who were dynamic leaders in their fields, so we could keep bringing new life into the book.
Okay. So do you bring them in and teach them a certain editorial process when they come in, and you say, this is the style that we use? Is that part of the training to become a editor on the book?
They've all read the book, and many of them have been contributors. But we have a team meeting with the publisher, Elsevier in Philadelphia, and we spend a couple of days looking at what the successes have been with the previous edition. We do a lot of surveys to find out what people liked or didn't like about the book, areas that we didn't cover as well as we could have, or that we covered well. And we really use that information to help guide us in the next edition. Mm-hmm. And then we divide the book up, and we each take a certain number of chapters that we are the primary editor responsible for, and work with the authors of those chapters to bring them to completion.
How do you, now you've got sort of 2 roles. I mean, you're the CEO of the OSU Wexner Medical Center, and working on that. How do you keep up with the field? Would I take to be a very large, rapidly changing field?
Well, and to answer your question, I didn't really answer your earlier question. How do you get this done? Well, if you ask people who do this, and it's, I think, also the same as you'd find if you ask people how they do research, it just takes the time in nights and weekends and holidays, and sometimes vacations. I mean, that's the time you have to put in to get this done. So I'll spend a weekend working on the book because I don't have time to do that during the week. So that's really been, an important part of that. Now, I get lots of medical journals, and I keep running files of articles that I think will be important to the authors who will be writing the chapters. So after we assign authors to prepare their chapters, I'll send them a group of articles that I think are essentials to be sure they'll update their chapter with those articles. And then I try to read as much as I can.
Okay. You wrote a June 2012 article for the Columbus Dispatch. It was all about the need to attract medical students into primary care. Writing for a newspaper like that seems like a fairly distinct genre from the kind of writing that you would do for either of these sorts of textbooks. Tell me about making that shift into communicating with a general audience. How do you decide what to include and how to write it, how to structure it?
I think when you're doing an op-ed piece, it's a much more conversational style, as if have someone you're talking to face and describing to them the issue you want to address. It is facts-based, and you have to make sure your facts are correct. We did an op-ed on the indebtedness of medical students, and we had several inquiries about the figure that we used to describe the indebtedness of students in this country and where that came from and what it was based on. So in a textbook, it's really so facts-based and so referenced, and you want to be able to support the statements you make. In an op-ed, it's a much more conversational style. You mentioned the pages before, 1,300 plus pages. One critically important decision we made was that as the editions come one after another, what the chapter authors tend to do is they'll add more references to the references that are already in the chapter. So you'll wind up with chapters that have hundreds and hundreds of references, dating back now 20, 25 years. And what we decided was to tell the authors that they would be allowed to have 100 references in the printed chapter in the book. Any further references would be in the online version. Okay. And that saved us hundreds of pages of references, but they're still available online. And with our book, and it says so right on the cover, if you open the inside cover and scrape off a little silver seal, you get an online code, and then you can access the book online, and there's some great search engines for the book in that respect.
Has that tended to lead to people culling all the older material and going with the newer material for the references? Or
yes.
So it's not just I have the most references kind of game anymore. No. It's I have the most recent, more like APA style, where you'd have the date attached to everything.
Exactly. And so we may, they may want to include some classic references that do go back several decades, but ideally we'd like them to include the latest information. The book cycle has been about 5 years, so what's happened in the past 5 years? Another thing we've done over the years is to make the book more readable and the facts more accessible. So after the first edition or so, we added 10 key points at the end of every chapter. You could look back at those key points and you'd get the key facts in the chapter. Then we added in this edition highlighted sentences or highlighted paragraphs. So if you said, boy, I got to get through this quickly, if you read the highlighted sentences and the key points, you'd have a good sense of what the chapter was all about. Okay. People want access to information quickly, and we tried to help with that.
Okay. That's one of the interesting hallmarks of medical writing, because you've got people who are often in a hurry trying to get that sort of information. And it brings me to my next question, because as a patient, I tend to regard, say, electronic medical records as sort of doctors filling out check boxes. And I'm curious about your take on the impact of something like that on medical writing and communication, because it is so just the facts, just the basic stuff. Is it changing the way that patients are described in the notes afterwards, or how they're described in the literature, because you look back and you see the check boxes as opposed to maybe a more written description of them?
Well, we have an EPIC medical record, which is the electronic medical record used by most of the major academic medical centers in the country, and we've been installing it over the last 5 years. Now, installing it sounds like it's you're putting in a new sound system in your house. It's really a cultural change. People need to learn how to use the electronic medical record. how to use it most effectively. We began with the installation of the outpatient record. That took several years. And then just about a year ago, in what's called the Big Bang, we did the inpatient record. To do that, we had to train 14,000 people. Everyone had to be trained to use the electronic medical record if they wanted to continue to work here. The nurses were a really important part of that transition. The great thing about the electronic medical record is that it is fact-based. The facts are easily accessed, but it also gives you the opportunity to use text to describe the patient. Now, what's really unique about the record is that you as a patient can access your record anytime you want to, and that's called the MyChart application. And we now have about 35,000 patients on MyChart. So they can look at the medical results from their testing, they can communicate with their doctor or nurse, they can set up an appointment, they can question something. And I know that patients will correspond and say, doctor, I was in the office, we talked about this, I went through MyChart, it looks like the results might not be quite what we talked about. Can you explain that to me? Okay. So it really, we practice what's called personalized healthcare, P4 medicine that's preventive, predictive, participatory, and personalized. And that really gets into the participatory part of healthcare. So patients access their record anytime. They don't have to worry about the office calling them after they've had a blood test. They can find out what the results were as soon as they're in the chart.
Okay. I want to ask a sort of a question that's a follow-up on the textbook, but medical writing is usually thought of as sort of an unemotional sort of thing, and but a subject like obstetrics seems like it would lend itself to remembering some of the patients that you may have seen, and they don't all end the way that you want them to end. And I'm curious about how that impacts your writing now as you've had all these years of experience. When you go back and look at these and you think, oh, I remember this, and this is a particularly difficult topic for you.
Well, you're absolutely right. And so what I do as we're preparing for a new edition is I'm always collecting information. So if a patient has an interesting ultrasound or X-ray or CT scan or heart rate tracing or pathology slide, we're always collecting that information. Of course, we de-identify everything. So there's no way that a patient could be identified. But we try to tell a story in the illustration. So we'll have the heart rate tracing, the ultrasound, and then if you read the legend, it'll give you that clinical vignette. And as you say, sometimes they don't end well. And I can go through the book and I can look at those illustrations and I can remember so many patients and their stories and what happened. And sometimes things ended well and sometimes they didn't, but it all comes back as you look at those cases. And, some of the cases have been in the book from the very first edition. Okay. But you don't forget the patients. You don't forget the patients.
Right, the people. Making sort of a big turn here for the last question. I really appreciate you taking the time to talk to us.
Sure.
I understand that you're an authority on popular music, especially apparently country music.
Yes.
Okay. So do you have a particular songwriter whose writing really moves you, and this is not related to the books, that you think of as, that's somebody that if I were going to write country music or any genre of music, that is the person that I'd like to have written that song?
Hank Williams.
Hank Williams.
Has to be Hank Williams. Incredible. I'm So Lonesome I Could Cry, Jambalaya. Okay. And then he had a series of songs that a lot of people don't know about, where he took on a new persona called Luke the Drifter. And they were songs about life and lessons in life. And he has one about gossip. Gossip is cheap and it's low. So unless you've made no mistakes in your life, be careful of stones that you throw. I always remember that one. Yeah, have to be Hank Williams, who died much too young.
Yeah. All right. Well, thank you, Dr.
Sure,
Gabbe,
thank you
for being here on Writers Talk.
Thank you.
And from the Center for the Study and Teaching of Writing at The Ohio State University, this is Doug Dangler. Keep writing.